How are
Hi,
you?
Adam.
Good to
How
see
are
you.
you?
Good. Thanks for being on. So I'm on with Dr. Wendy Roberts for Rancho Mirage, dermatologist of the stars, and
Hi.
a friend of mine. Thanks for being on. How is it in California now?
Oh, well, thanks for having me. This is great. I love seeing you.
Likewise, likewise. Um, so are you in your office now?
I am. I'm in my office, and
Good.
this is it. Here we are.
Yeah, very good. So is the office open? And
Yes,
you're seeing
yes, the
patients?
office is open.
Yeah.
I'm
Good.
seeing
Good.
patients. Actually, it's kind of interesting because I never did close. I never
Okay.
closed. I I continued to see patients, and it's kind of an interesting story because when everything hit, as an essential, I'm essential. I'm a physician, obviously, but also, my background in surgery and emergency medicine, I just really didn't feel comfortable closing. I like, what am I going to do? My patients might need me. Well, what if they have some other problems? Some of my patients who don't, are healthy and don't have primary doctors, you even act like a primary doctor for writing, a script if they need an antibiotic, they have a cold, a family member. So I act as a primary doctor for some of my people, and I wanted to be there for them. And but I also had to, make sure that my office was safe. So back in late February, I just reconfigured the whole office, and
Okay.
I was very blessed, to be able to do that, and kind of thought it out. What did we need? It's turned out really great because I call it VVIP experience, which is, very, very important person, because people park outside, we come and get them, the door is always locked, we bring them back right through the reception room, which is empty, into their private room with their private water and beverage, and it's so everybody feels really safe. It's worked out well. And I've had so many interesting skin problems that have arisen during this. Several patients with lupus flares and bullous diseases. It's really, been very kind of an interesting journey for my staff. And I was able to keep all my staff employed, which really was important, to me, to be able to not have to let any of my girls go.
Right. Right. That's so good. Are you seeing more skin infections and abscesses
It's
than
so
usual?
interesting that yes, it's so interesting that you asked that, because as I really am, I've had so many abscesses in this last 2 months. Then, I do everything. I do aesthetics, but I also do medical derm. And I heard my intro. Thank you for that lovely intro, pathology. So I've been INDing abscesses a lot, and I don't know, why. I don't know if it's COVID related. Could be serendipity. I don't know, but I definitely am seeing a lot more infections, and I'm so glad that I was able to be there, for my patients, because so many places were closed. They would have nowhere to go. And I got to share this with you. I worked as a cruise ship doctor.
When was
Um,
that?
yes, I did. I did. Uh, that was like a lifetime ago in Hawaii, for
Okay.
American Hawaiian cruises. So I'm
Okay.
officially a merchant mariner. Military
Okay.
people out there, I'm one of you guys and girls. Yeah, I'm a merchant mariner, and it was in between my surgery residency and dermatology. I went to Hawaii to take a break and just, cool out, relax, and enjoy nature. And I
Uh-huh.
could, and they tapped, because of my trauma experience. they found me and tapped me on the shoulder and said, you know, we think you'd be a great cruise ship doctor. So I dealt with everything on that cruise ship. I mean, stories. We have to go offline for some of the stories. I have stories forever, but I really learned a lot of medicine.
Yeah. So I want to go over some of your background because you're the most interesting woman in medicine, or one of them. So you went to medical school. Where'd you go to undergrad?
I went to Sarah Lawrence College.
There. Okay. And
Sarah
where is
Lawrence
that?
College in Bronxville, New York. It's in Westchester.
Westchester. And then you went cross country to Stanford for medical school.
Right. So in Sarah Lawrence, I came in as a dance major.
Okay. All right. That's even more interesting.
Yeah.
This is going to be a great video for your son to see, who's going to get to know mom a lot better. So then you go from Sarah Lawrence, you go to Stanford for med school.
Yes, I went to Stanford. That's
And
when
then,
I came to California. I was just a New Jersey girl.
okay.
Who went to college in New York, and then I came west for medical school to Stanford.
Great. So you go to Stanford, finish there, then you do a surgery residency.
I do half of a surgery residency, half of it.
Half of, okay, so like that's usually it's 5 years, so you did what, 2 or 3 years?
Yes, I did 2 years trauma.
Trauma, okay.
It was all trauma surgery.
Okay, all right. Blood and guts, all right, cool.
Shoot them up, bang, bang. Yeah.
All right, and then, so you were in Palo Alto then?
Yeah, I was, no. So when I left Stanford in Palo Alto, and I went to the East Bay, to the Alameda County Trauma Center,
okay,
known as Highland General Hospital, Oakland.
Okay, Oakland, all right.
And this was in the middle of the drug wars, and there was lots of trauma. I think my first day, there were 5 gunshot wounds. I changed my scrubs 5 times. Gunshot wound to the head, to the chest, to the back. It was unbelievable.
Okay.
And I did that for 2 years. My second year, I ran the intensive care unit there. So I did got a lot of good ICU experience. And then I decided that this was not going to really viable career option.
Yeah, you like jewelry and you like to be in the limelight, so that wasn't going to be cool. Being up all night.
Yeah, it was stressful.
All right, then so you do dermatology. Where'd you do that?
So I did dermatology at King Drew Medical Center here in LA.
In LA, okay. And dermatology is the hardest residency to get into, guys. Everybody watching out there. So you do that. That's probably what, 3 years?
Yes, that was 3 years.
Okay. And then from there, you went on to do another fellowship in Derm Path.
Pathology. Yeah, pretty much into my 3rd year, I realized that I might know all of these things about the skin and how things appear on the surface of the skin,
right.
But I really knew nothing about what was happening underneath besides, the pathology we did. And really to be knowledgeable, and, I'm all about having a deep knowledge of whatever I'm doing.
Sure.
That I needed to do a pathology fellowship so I could understand. And I was very fortunate. I was at a lecture at UCLA, and this great doctor, Dr. Ackerman, came in and gave this phenomenal lecture. And I ran up to him and said, you are the smartest person I've ever met.
Right.
And I want to study with you. He said, come on, Wendy, sure. And off I went to New York, back east at NYU, and did a Derm Path fellowship.
Okay, back
so
across.
I did,
all right.
Yeah. I did 16 months. And after I did that, then I was done. That was officially the end of my training.
Okay, all right. So you just didn't happen to go on TV right from college. You did some work in between, like 15 years of training or something. Fantastic. When did you go back? When did you go back to Rancho Mirage?
Well, I went back to Loma Linda University.
Okay.
And I started there. I'm the founder of their dermatopathology program. And I did that and worked with the residents and taught for 4 years as assistant professor. And after 4 years of that, I matriculated down about an hour east into my current home, which is Rancho Mirage, where I've been ever since.
Great. And
in
then
private practice.
right, you've got so much that I want to cover. I'm speaking to Dr. Wendy Roberts from Rancho Mirage, and so then you came up with a system of classifying skin skin of color and how different therapies impact skin of color. So go over that, how that come about, and what are the
great.
takeaways there?
Well, back in the day, there was only the Fitzpatrick skin typing classification system.
What are those? Just let people know.
So Fitzpatrick is kind of the way we classify skin, and it's kind of based on the color of your skin and whether you burn or not. So, you have a Fitzpatrick 1, which is someone very fair, red hair, blonde hair, blue eyes. That person, when you go out in the sun, they get red and they burn immediately. And then there was the Fitzpatrick 6, which is the darkest skinned person. Okay, that was perceived at that time that they didn't burn. And the Fitzpatrick was great. However, as aesthetic and surgical dermatology was moving forward, we need a skin type to tell more than about burning, because as we know now, right, 25, 30 years later, skin of color can scar from lasers, can get keloids from surgery, and really is a sensitive skin that a lot of complications can happen to if you don't know what you're doing. And where my skin type came in is that it really is as for all skin types, for all colors, for all races, because the essence of the system is that I don't care if you're from, Lebanon, if you're a man, if you're a woman, none of that matters. What we need to know to keep people safe is, what does your skin do when we injure it, right? Let the skin do the talking.
Right.
And with all our globalization and mixing of skin types, many people are, biracial and have all different types of nationality. So you can't look at, I call it the Oklahoma blonde. So yeah, right. We have Carrie Underwood. She's a beautiful Oklahoma blonde. You can't just look at the Oklahoma blonde and say, oh, she's white, and let's set the laser up to the highest strength and hit her with the laser. Because when you do that, her Native American heritage might come say hello. And what do I mean by that?
Yeah.
Her Native American heritage could cause skin discoloration, scarring, all of those complications. So we have to go deeper than just looking at a person and assuming how their skin's going to respond. So my skin type system breaks down. We have 4 different elements, and we look at the Fitzpatrick because that's very important. We look at photo aging, how aged is your skin? We look at pigmentation, and we look at scarring, and all of those are put together. It's like a blood type code. You get a little code, like you would get your code, and you can use that when you go to the doctor. This is my Roberts skin type classification, and I can tell you, okay, you tan when you go outside. Your pigmentation, you don't pigment when you have injuries, like if the dog would scratch you, you don't pigment. Scarring, you don't scar much. And your glow gal, not aged too much. So then I know how to set the laser.
Okay.
I can set the laser. I can do the procedure, pre-treat, post-treat, because it's your skin that's talking. I know how your skin is going to respond. So it's all about procedural safety.
Right.
Everyone's had that little mosquito bite that turns into a horrible brown scar.
Right.
On their hand, and it wouldn't, let's say, in a friend of yours, but it does in you. Why does your scars turn brown and your friend's doesn't? It's all about genetics, and that's what my skin type gets to the bottom of.
Right. Okay. And is there any DNA testing that you can do? Have you gone on further to expand on it with DNA testing, or is that far-fetched?
No, it's not far-fetched at all. Right now, it's you get your skin type via history. I ask you questions, right? Where are your grandparents from? You know, do you ever scar when you get a scratch? Do you have any keloids? So we come up through clinical, and also I'll address people and look kind of an anthropological type of search. I'll look for evidence of scarring, evidence of keloids, evidence of hyperpigmentation.
Okay.
So that's currently the way it has been. But I mean, definitely, you know, a swab and a genetic, it's not out of the realm of the future. And genomics is where we're going for everything.
Great, great. All right. So next topic, you have had a lot of leadership positions in dermatology. You're president of the Women's Derm Association, which is probably the most powerful group in dermatology, in my opinion, from an industry standpoint.
I like your opinion.
Yeah. and so CalDerm, so you've done a lot there. You probably do a lot of mentoring. Is there anything you want to, I'm sure there are some people in the audience who'd be interested in that.
Well, you know, I call it organizational service.
Yeah.
And it's important to get involved and hold those positions. You know, put your imprint on an organization, because we all have different opinions and we all see things from different lenses. Right. And we can all, you know, bring something. So I just encourage young people out there, you know, if you'd have told me I'd have been president of the Women's Dermatologic Society when I was, you know, dancing with the Garden State Ballet, I would have said, you're crazy. I have no interest in organizations. You know, I'm a me person. I'm a solo runner. I don't need an organization. But as, you know, you grow and evolve, I see that these organizations are happening whether you participate or not.
Right.
So if you have thought and you have a heart, you see how you might be able to make a change. So, you know, I would just say get involved, because these organizations really need you. Exactly. Otherwise, it could be the same blah, 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 blah organization, because it attracts the same type of people. So someone like me with a kind of a, you know, different eclectic background, I think it was great for WDS and also for CalDerm. So I think organizational service is great, and, you know, make time to do that. You'd be surprised, and you get back so much too. It's really wonderful.
Right. So let me jump to, so fantastic on that. I'm with Dr. Wendy Roberts. Now, you've been on a bunch of TV shows, and my staff absolutely wanted me to ask you about Chasing the Cure. So how did that start, and how many episodes you do? And I know you had the most diagnoses there, so tell us a little about that.
Yes, Chasing the Cure with Ann Curry was an amazing show. And there are certain shows that are just made for you. And when they tapped me on the shoulder and asked me, did I want to do it? You know, I had that background they were looking for, the dermatology, the derm path. You know, I'm so antisocial, right? So, you know, I'm a communicator. So it really had all that, because basically we were solving these medical mysteries. And these medical mysteries were, you know, these patients were suffering, some of them for decades, with these problems. Now, they weren't all skin problems. Right. Some of them were other problems, but they had skin symptoms. So, you know, this is the shout out for dermatology. We're important because dermatologists know a little bit about everything in medicine. And we study so hard, and we've got all these syndromes in our head that I would see something and say, oh, I know what that is. And they're like, well, you're just a dermatologist. I'm like, no. Because the skin is the largest organ of the body. And eventually, I think everything shows on the skin. Unfortunately, now we're even seeing COVID, right?
Sure. Yeah.
You hear about COVID. It started off in the lungs, but everything winds up on the skin. It really does.
Right.
And so I was able to give input to the other physicians. And yes, I did. I couldn't believe it, but I solved the most cases on the show. So they gave me the sleuth award. So
how does a patient get on that show? How do they get on there from a patient standpoint?
Yes, they write in, they call in, they have producers, which, you know, tap into physicians all over the country and who have gone through. And it's amazing how many of them were just undiagnosed. You know, they've been to 6, 7, 8, doctors, they've been to institutions, but I think what the show provided was a group of dedicated, you know, doctors who didn't have to see other patients, right?
Yeah.
We could all just focus on that one patient,
Right.
and get the testing and everything that that patient needed. It really made a difference in the lives, and that, you know, the mystery on solving the mysteries is something that for me was like being in a candy shop. You know, I couldn't get enough of it. I love to solve problems, and the people were so amazing and so grateful that it just, you know, we would just cry routinely. We'd be, you know, this is pre-COVID, we'd be hugging and crying because these people had suffered so long, and there were a lot of different things. They were genetic disorders, some of them were acquired, but it really made a difference in the life of people, and that was like the best. It was one of the best experiences of my life to do that show.
How fun. And how long did you do that show?
It was on for one season, one full season, which I believe is like 10 or 12 episodes.
Okay. And how many hours did you dedicate to that show altogether?
Well, the taping would be like a half a day. But the show itself, and then, you know, doing the show itself, it was like a 2-hour show, then went to an hour and a half. But the preparation was a lot because I was looking up stuff. So I would say probably about 2 to 3 hours a day I dedicated toward the research involved in that show, or somehow, you know, talking with the producers or working out things.
Okay, how fun.
I just wove it in there between, you know, a biopsy and a filler case.
Right. You probably learned a lot of medicine, additional medicine. We're lifetime learners. You know, that's the beauty about medicine. I'm a cardiologist and now in you know, skin diseases, and I love reading and learning about new areas. I imagine it was the same for you.
Oh yeah, it was great because, you know, there was a physician panel, and, you know, and Sheila and all the doctors. I listened to their debriefs, and, you know, so I would learn a lot because they had their sections when they would talk about their reasons, their reasoning, why it was this and that, and we would talk about a differential. And sometimes I'd have to kind of convince them to listen to the dermatologist, you know. So yeah. I'd have to lay out my case and give all the reasons why I thought it was this and not that.
Yeah.
But it was just a great group of people, wonderful collaboration, and a shout out to Kim Bondi, who was the producer, because she did an amazing job. Kim, you're awesome.
Good, very good. And then you've been on the Steve Harvey show and the Doctor show. So you've been on a number of
yes.
And what has been the experience on those shows?
Just great. I mean, it's amazing how professional everything is. You know, the groups that solo, like Steve Harvey, he's so smart. He's funny, but he's also very, very smart.
Yeah.
And he's sharp. And it was just a pleasure to work with him, how focused he is and how comfortable, you know, he made me feel. You know, the doctors are just wonderful. You know, all of the doctors are great on that. And they're, again, so experienced and so committed to delivering the message. The Real was a great group of ladies, young women. The Real, just, again, very sharp. So, I learned a lot from every show and got to meet some really nice, professional, amazing people. And, you know, media is fun. And you're right. You always learn a lot. I come on as an expert, but I go away, you know, as a student, having learned something.
Right. And it turns on the juices, internal juices, to get ready and be prepared. And so you're going back to medical school, you know, there's a test tomorrow.
Yeah, exactly.
Yeah, great. So let's kind of change topics. And you've got a 3-year-old. And how is he doing with COVID and all that's going on? What does he know? Tell us a little bit about what you're doing, you know, personally for him, your family. Huh?
Yeah, I got a 3-year-old Jonah, and of course, that's the light of my life. And this was a big year because this was his first year in preschool.
Yeah.
So we started off preschool and loving it. And, me and the other moms, we all stand around every day and watch them do their little morning, Pledge of Allegiance and all of that. And I made some really good friends there.
Yeah.
So I adjusted my schedule. So I took, drove him to school and picked him up every day.
Oh, wow.
And yeah, I did it myself. I really, want to be very involved in his life. So I made friends through that. We'd stand around and talk while they did their. So when all of this came, COVID came, we were all really sad for the children. Also we miss each other and all of the friendships that kind of have happened. And the kids are young, Jonah doesn't really know. We talked about the virus and we colored with masks. And when I take him out, I have a mask on him. He doesn't really go anywhere, but when let's say if he comes from the house to my office, everyone in my office is masked. I told him, so honey, you got to wear a mask too. He loved it. He really took to the mask.
Okay.
So we put a little mask on him. And we're fortunate being down here in Southern California in like a suburban area that we can run, and play. I had just gotten him a puppy. So, now that puppy is, we call him King Kong. The puppy is huge. Yeah. So we watched the puppy grow. And they got me on that one. The dog is huge. And we walk the puppy and we play. And, I just talked to him. He wants to know why he can't. His cousins came the other day, and usually they swim together, and we couldn't have that, and he couldn't understand. And I explained to him because of the virus that's making people sick, and we have to, be safe. So he gets that. He's a little sad about it, but just trying to, 3-year-old boy, swimming, running, playing ball, just trying to burn up that energy.
Right. Right.
Yeah, baking. So it's been different. But what I will say is that I again adjusted my schedule.
Yeah.
To be home with him more.
Sure.
And there's nannies in the most of the day, but because my office was open and I was working, right, we cut back our hours so I could get home to him. So it's been really nice at this developmental age, as you know, having children, that to see, to be able to be really involved and learning those ABCs and numbers. And I really enjoy that we're spending more time. So I feel like that's a silver lining. I'm spending more time with my son.
Yeah. We've been able to do the same. So and now we're going through the planning for the school year, which is going to be a challenge. Are California schools going to open in the fall, you think?
We don't know.
Yeah.
We haven't really heard, it doesn't look like summer school is going to be. They tried to do a July, push for a July opening of schools, but that was shot down by the, California teachers because, really they've been working, doing the online training, and they need a break. Yeah. So, they can't start school back in July. So we don't really know when we're going back to school yet. Unfortunately, I don't think summer school is going to be, feasible. And I guess this is a good time to just say that I think that it's very important that everyone know that we do not know this virus. It is novel. We do not know. So we can't, put things onto it. Oh, well, it's going away, or, oh, it's going to do that, because it really is a stranger. We have no idea how it acts. So it may not go away. If you had it already, you may have to get it again. No one knows. Right. So you can't say, well, I already had it, so now I can just be, take off my mask and run around, and that's not necessarily so. Right. And the other thing is that we don't know the internal organs that it's affecting. maybe you seem okay, but how do you know that it's not affecting your kidney function or something for the future?
Right.
Right? Because we don't know. So I think that's a message I really want to get out to people. If we doctors and scientists don't know,
Right.
then people who aren't, listen to what we're saying, which is don't think that everything is what you might think it to be.
Right.
Because the history of science, I mean, just to go back a little bit with AIDS, right? Because I practiced during AIDS. When I was doing trauma surgery, we wore these little flimsy gloves. Okay. AIDS wasn't here yet.
Right.
And then AIDS came in. And then we were told, oh, it was just by, secretions, like kind of sexual contact.
Right.
That was the only way. Okay. So people thought, oh, well, it's just sexual contact. No worries. Well, then a few months later, we found out, oh, no, actually, it's all secretions. It's, respiratory, everything.
Right.
Oh, okay. Then, but it's just secretions. You have to be in contact, right? That's what we were told.
Right.
You can't get it from anything else. But then months went past and we learned that you could get it. The virus, the HIV virus, was isolated from a Formica tabletop. Okay. Oh, but it only lives on the tabletop for 2 minutes.
Right.
And then guess what? Not so. Then, because science is evolving, we found out that it lived on a Formica tabletop for something like 12 hours. So literally, the virus could be there. Someone could walk away. You could come to that tabletop, put your arm, put your hand down, then touch your face. Boom, you get infected. So science evolves.
Right.
And it's not that anybody is trying to deliberately give you wrong information. It's just the way science is.
Right.
So this virus is completely unknown. We have no idea what it's doing. We're just starting to see these horrible diseases in children. Because remember at the beginning it was, oh, children were safe. Well, now we're saying that children are not safe. And there's this Kawasaki-like syndrome that's happening in children, which is horrible. So I just want to say to everybody, please be cautious and common sense. Just be safe. I think everyone should act like everyone is infected.
Right.
And
right.
if you do that, then you will kind of stay out of trouble. You won't infect anyone and you won't get infected because we know that masks have been used since the beginning of time. We know masks prevent disease. Otherwise, people in the hospital would not be wearing masks.
Right.
So 20 years back, everybody was wearing masks in a hospital for a reason, right?
Right.
So masks are important and they protect other people and they protect you. And we just all have to be safe and just try to get through this until we can get a viable vaccine.
Right, right. Well, that'll be 18 months. So you think everybody should just, hunker down at home and the economy shouldn't reopen or what?
No, I think the economy, it's important for the economy to open. But just like, I was saying earlier, I reconfigured ways in my office. We have to reconfigure the economy. And, we're a really smart country and we can do this, but you can't sacrifice human life for economy.
Sure.
Because every, what is it, 80,000 people, those are all people who had mothers and fathers and sisters and children and loved ones. And no one wants to lose a loved one. So
right.
I just put myself in the position of those 80,000 deaths and think, would I want to have been that? Would I want my son without a mother? Would I want to be without a son? And we've got to be smart, which Americans are smart, and figure out how to get the economy stimulated, but still be safe. And,
right.
I've already seen it down here. People are reconfiguring offices and doing, what it takes to be safe. So I think
Right.
they're not exclusive, and we can do both. But it
Right.
takes a commitment. It's not head in the sand. You have to deal with reality and facts. We can fly. We just have to fly safer.
Right.
We can do all those things, but this is the time for all of the smart people in these fields. Every field has leaders, and those leaders have to step up and figure this out.
Right. Right. Yeah. So you think people would be safe being out with what number of people? I mean, for instance, Jonah, if he's going to go back to school, or are you going to keep him out if school opens?
Well, this has changed, Oz, because at first I was, right? But then this Kawasaki thing has come out in toddler children.
Right.
So, no, he's not.
He's not going. So because of the Kawasaki, you've changed your mind.
Yes.
If I wrote about this on Facebook today. There are three categories of people.
Mm-hmm.
One, I cannot absolutely get. There's zero risk tolerance that I have, so I think those people should just stay home, and isolate, test everybody, and just be hunkered down. So perhaps somebody over 65 or 70 with a medical illness would do that. And then the middle part is, hey, you're going to take the precautions, hand washing, mask, etc., not loiter in grocery stores, but you're going to get out. You're going to get out and live and be.
Yes.
You're not going to go to a football game, but you're going to be around 10 to 50 people and be sensible. Mm-hmm. But you're not guaranteed that you're not going to get an infection. So right. which one of those two are you going to be? The one that's going to be super isolated, or the one that's going to be sort of in the middle? And then the third group, they're just nuts, and they're putting everybody at risk. And that's what the government is really worried about, is to really control those people, because they're making it bad for everyone.
Yes, right. It's always, there are outliers in every field, in every situation. No, I call them kind of outlier know-it-alls, because these people, it's nothing. They know everything.
Right.
But they know nothing.
Right.
They know nothing, but they know everything. And that is a dangerous group. Nothing worse. We learned that in surgery. There is nothing more dangerous than a know-it-all.
Right. Right. Exactly.
You think you know everything, you know nothing.
Right. So have you looked at the incidence of Kawasaki? Kawasaki, for the audience, it's inflammatory disease that involves kids. They get a rash and abdominal pain, and it impacts their heart as well. And it's a very, very bad situation. And COVID also creates this entire inflammatory reaction, vasculitis in adults, with clotting from head to toe. So it is a very, very different disease. And in kids, the manifestation of that inflammation could be as Kawasaki's. How many cases have been reported? What are you seeing? Because I've not been paying as much attention to it as I should. And if you have 3 cases, and you talk about it over and over again, it sounds like 3,000 cases.
Yes, that's true.
So what is it?
Yes, I don't know the exact number of cases.
Right.
This data is just, kind of falling out. But mostly, I believe, from the East Coast,
right.
Areas that were affected more heavily. But it's to see that children are affected at all.
Right.
It, gives me pause. So we just have to wait and see, what it is. And I love that point where you said 3 could be 3,000.
Right. I mean, it's just, we have to really be involved as physicians. I didn't really do a lot of social media and all that before. I mean, 60 days before, I was, quiet and didn't really even know how to use social media. But because of all the fear out there, I've really gotten involved to really help myself, help my family, and help people around that trust me to help them navigate. I think we need to really be careful with with the Kawasaki in children, because now we're creating a totally different level of fear. And to me, one of the ideas that I had about school, and I want to think about this, is sputum Saturdays. So every Saturday, you have the kids go and let them spit in the cup, and you test. If they're negative for COVID, they can go to school that week. If they're positive, they stay home. As opposed to having a 3-year-old wear a mask and temperature checks and the teacher has a mask and all that. It's chaos,
Really.
Not going to send Sophia to school in that setting, but maybe there's a scientific way to send them back to school.
I love that idea, but see, that's what it's going to take. Just like, you're a cardiologist, about Kawasaki's, you're a scientist, and you're coming up with a viable idea. I love that idea. That's what it's going to take. It's going to take a lot of brain power and experience to get back to normal. Right. At least to get back to where we feel comfortable, and we're not, more of us can be in that second group of people.
Right.
Than that first, isolation. I there's no way that, young, active people, young families, children can stay in number one in that group. It's just not going to happen. Right.
So 1 and 2 should work together to keep 3 in check and educate them. This is very serious. You don't want to.
I know. I always tell you, keep open, group 3. Stay open.
Yeah, right. I mean, they're going to be the ones that will close everything down. And I do think that we have to really, if we're going to really be very, very stringent, it should be around nursing homes and hospitals. There should be a lot of testing. Unfortunately, there are, patients sent into nursing homes that infected a lot of other people. So we're learning, we're learning from that. And then I think we should also learn from other countries like Japan. They have very few cases. It's a very densely populated, country, obviously. So
do we know are there any lessons from Japan that you learned of?
I don't know yet, but I'm gonna really look at it. Japanese are very different socially as well. Like when you walk in China, people are really close to each other. They'll get closer to you when you're walking in the street. So they're very, very congested. You go to China, you go to Tokyo, and when you're walking, they actually socially separate anyway on their own. I was on an escalator on the wrong side, and the guy just kind of moved me over to the side. It's a very clean city. It's the most interesting city you'll ever visit. There's no trash on the street, and there are no trash cans. So they're at a different level of hygiene and thinking. You go to their fish market, 800 stores, you don't smell fish there. So the level of where they are, I think we can really learn.
Hygiene.
They're much better at sun protection than we are. They wear masks. So I think there's a lot to be learned from the Asian countries.
Yeah, I mean, remember when years ago you'd see someone in a mask and look side-eyed at them, right?
What's that?
I said, remember, like 10 years ago, you see someone in a mask with a mask on a plane or something, you kind of, it's unusual.
Right. And also for dermatology, I mean, they wear hats and they really cover up. They protect against the sun. Much better than we do, as they do in Australia as well. So there's a lot for us to learn. Yeah.
Yes, there is.
Well, listen, I don't know how long we've been on, but it's been 45 minutes. It's been awesome. This video is great for Joe.
I have a question for you.
Yeah. Okay.
Yeah. So what clean products are really good for us to use with our patients and with our children?
Well, I think the body wash is going to be the best product, and we've actually developed a little hack for that, where you can put almost as a hand sanitizer, as a leave-on gel. So that's going to be to me the best way to approach it. You just put a little bit of the product on. So I just carry some with me and use it as a hand sanitizer.
Oh, great.
I work on the computer and whatever, it doesn't get
Oh,
sticky.
you can work with it.
You can work with it. So it's almost like a little silicone. It's not going to break down your skin. We've done RIPT testing on it. So you've got sodium hypochlorite and 3 surfactants on there. And then when you get to the sink, within the next 15, 20 minutes, then you go wash off. And if you have multiple interactions outside, then you can do that.
Right.
Because we're running some coronavirus testing against it as well, which it should kill it. So
that's good.
Yeah.
Because there's the surfactant is just what's in regular soap, like washing your hands, correct?
Yeah.
The surfactant is just like in soap washing.
Right. So coronavirus is an envelope virus. It's actually very responsive to any soap. That soap will kill the envelope, will break down the envelope, and that's why 20 seconds of hand washing is so awesome. So the problem with all the hand washing is your hands, break down. And there's my daughter, Emily. Hey, Emily, this is Dr. Roberts. I want you to meet her, okay?
Hey, Emily.
Anyway, so we feel like the product would be really good for, patients with hand eczema, psoriasis, frequent washing, and they can use it as a leave-on or as a wash. And then, obviously the moisturizers would be awesome for that as well. And we're also just introducing a hand wash with sodium hypochlorite and glycerin, which will be available in the next couple of weeks, and we'll announce that. I think body wash or sport wash would be the key product that you should have, and I can send you.
The sodium hypochlorite, which is the main ingredient in all the products, is basically bleach. Yes.
Yeah, it's the good stuff in bleach, and it's similar to a bleach bath. The concentration. Yeah.
And we love bleach.
Yeah.
Nothing like the smell of bleach.
Bleach is,
I don't know if we're going to be
popular than organic now.
It's very true. Cleansing is definitely in as it should be, and I don't know if we're going to have my meeting GDerm next year. I'm hoping we had it this year, generational dermatology, but I hope that you're invited. And I think that, we all really can focus a lot more on, the science behind cleansing, why it's so important. And I know everybody's got their ears up now on cleansing. So please come to the meeting. Hopefully we'll have a meeting.
That's next February,
Yeah, it's President's Day weekend. So it'll be President's Day weekend 2021.
Okay.
So if indeed 2020 is closed, that's what you're seeing. 2020 closed. Hopefully we'll be open in 2021, and I'll be able to, have my meeting, because it's a really exceptional meeting. A lot of people, and they're all at the podium, and they're all wonderful, and we have a lot of fun too.
Yeah. Okay. Well, we'll commit to come if you have it, and I hope you do. And I'm sure Beverly would love to be there, and Joel as well. So
yes,
that'd be a lot of fun. I know you have like 300 to 400 people there, and we didn't get to talk about your generational derm concept and the way you take care of the whole family and the entire family. Tell us a couple of things about that, and then we'll close it.
Yeah, we'll close. Yeah. So generational dermatology is basically this. It's practicing, medicine on a primary prevention level. What do I mean by that? When you see a patient in the office, the patient may come to you with, let's say, rosacea, a red face. And the rosacea is in full bloom. There's veins and pimples, and the face looks really bad. Well, that didn't happen overnight. That patient was at risk for rosacea, probably decades before. So we want to start when our patients are younger and pinpoint their risks and then manage them so they don't get those diseases, right? And we do it similarly like with skin cancer. We put on sunscreen and we prevent skin cancer. But we can also do it for a lot of other diseases, melasma, acne, and even young people into aesthetics get it. You know, don't wait for 30 to start your injections. Do it in your 20s, because you don't want your face to get used to forming that wrinkle. So
Right.
what you do, you use neurotoxin in your 20s. This way, you ameliorate or get rid of the reasons why you're getting the wrinkle in the first place. And that's why you see injectables being done younger. So a generational dermatologist, which is what I am, not only takes the patient, but the patient's family, kind of from cradle to grave. You're taking care of mom and dad and the brother and the sister, and you're pinpointing things that need to be looked at, right? Hair loss, the boy. Why wait for the boy to lose his hair when you know he's going to, because everyone in the family loses their hair? Get on it, you know, get on it earlier and prevent that hair loss. So that's what generational it's about. It's about prevention, and it's about taking care of the whole family, similar to like the family doctor.
Right.
It's the family dermatologist.
Great. Well, that's a great explanation. Thank you so much, Wendy, Dr. Roberts. Always enjoy talking to you. You're very interesting, and you've got a great heart, and you kept all your staff there and kept your office going and supporting your patients, and you're just awesome to be around. So hope to see you in person soon.
I told you, you're the person I want to sit on a cross-country bus trip with.
Okay, very good.
You're great. Yeah, thank you, Dr. Anwar.
All right. Thanks, everyone. Bye-bye.
Okay, bye-bye.